A public service announcement. What is a personality disorder? This message is brought to you as a public service of In His Holy Name Ministry and the Independent Catholic Podcast.
Personality disorders are mental health conditions that can affect the way a person thinks, behaves, and interacts with other people. They are usually diagnosed by a mental health professional based on a variety of criteria, including observations of the individual's behavior, thoughts, and feelings. According to research, about 10% of the population of the U.S. has a personality disorder. Personality disorders are diagnosed in 40 to 60% of psychiatric patients, rendering them the most common of all psychiatric diagnoses. Studies estimate that between 65 to 90% of people treated for a substance use disorder have at least one personality disorder. Personality disorders can be divided into three main categories: Cluster A, odd or eccentric behaviors, or Cluster B, dramatic, emotional or erratic behaviors. Or lastly Cluster C, anxious or fearful behaviors. Each type has its own unique set of symptoms that can have an impact on the individual's relationships, work life, and social life. It is important to remember that personality disorders are not just about having an unusual personality but rather about having difficulty functioning in everyday life due to intense emotions or behaviors. Cluster A personality disorders include paranoid personality disorder, schizoid personality disorder, schizotypal personality disorder. There are 4 personality disorders in Cluster B, including antisocial personality disorder, borderline personality disorder, also known as emotionally unstable personality disorder, histrionic personality disorder, narcissistic personality disorder. Disorders in this Cluster C include avoidant personality disorder, dependent personality disorder, obsessive-compulsive personality disorder. It is possible to be diagnosed with personality disorders from different clusters, according to a major study. The most prevalent personality disorder is obsessive-compulsive personality disorder. The second most common is narcissistic personality disorder, followed by borderline personality disorder. Personality disorders appear in men and women in roughly equal numbers, however. Certain personality disorders may be more likely to appear in one sex or the other. Nearly 75% of people diagnosed with borderline personality disorder are female. Men are 6 times as likely as women to be diagnosed with antisocial personality disorder. And narcissistic personality disorder is more common among men than women. Personality disorders are often harder to diagnose than other mental health conditions, such as anxiety or depression. Everyone has a unique personality that shapes the way they think about and interact with the world. If you think you or someone close to you may have a personality disorder, it's important to start with an evaluation by a mental health professional. This is usually done by either a psychiatrist or psychologist, to diagnose personality disorders. Doctors often start by asking a series of questions about the way you perceive yourself, others, and events, the appropriateness of your emotional responses, how you deal with other people, especially in close relationships, how you control your impulses. They might ask you these questions in a conversation or have you fill out a questionnaire. Depending on your symptoms, they may also ask for permission to talk to someone who knows you well, such as a close family member or spouse. Once your doctor gathers enough information, they'll likely refer to the new edition of the Diagnostic and Statistical Manual of Mental Disorders. It's published by the American Psychiatric Association. The manual lists diagnostic criteria, including symptom duration and severity, for each of the 10 personality disorders.
The treatment that's best for you depends on your particular personality disorder, its severity, and your life situation. Often, a team approach is needed to make sure all of your psychiatric, medical, and social needs are met, because personality disorders are long-standing. Treatment may require months or years. Your treatment team may include your primary doctor or other primary care provider as well as a psychiatrist, psychologist or other therapist, psychiatric nurse, pharmacist, and/or social worker. If you have mild symptoms that are well controlled, you may need treatment from only your primary doctor, a psychiatrist or other therapist. If possible, find a mental health professional with experience in treating personality disorders. There are no medications specifically approved by the Food and Drug Administration to treat personality disorders. However, several types of psychiatric medications may help with various personality disorder symptoms. These might include antidepressants, mood stabilizers, antipsychotic medications, and anti-anxiety medications. The first-line treatment of personality disorders is psychotherapy. However, it is not uncommon to have prescribed multiple medications in a manner unsupported by evidence to accompany psychotherapy. Ultimately, the treatments used to improve symptoms among patients with personality disorders will be based on the severity of symptoms and may include outpatient psychotherapy and medication, as well as hospitalization.